Hello and welcome to another episode of Fundy Tidings. I'm your host, Jay Remer, and today I have with me as my guest, Lisa Cheney. Lisa is back for another kick at this can, and Lisa is the Community Program Coordinator for Community Health Association of New Brunswick, and she represents the Charlotte County area. And welcome to the show, Lisa.
Thank you, Jay.
So, I haven't had an interview with you for a few years, and so much has changed. And one of the things that I was most impressed with when I went to the CMHA website was how many offerings there are. And so it prompted me to get back in touch with you and say, we have to bring more awareness of your organization to the general public.
Awesome.
So what I'm wondering is, how would you describe the role of CMHA in the community at the moment?
So we have evolved quite a bit since COVID, of course. Originally, we were doing things within the community, so workshops, presentations, events to bring awareness, those types of things. But then when COVID hit, we turned to the internet. We all became skilled at Zoom and Teams so that we could provide this information on a wider scale, trying to reach the people that we haven't been able to reach. Teaching people how to get online with Zoom. So we've been able to take our show to the internet kind of thing, so to speak.
And what is that show exactly?
So there's lots of things, and I say that we've taken it to the internet, but we've also added new programs. So on the internet, or YouTube channel to be specific, you can find a plethora of videos, webinars, different topics: anxiety, depression, self-care, positive attitude. These are all webinars that we have put out there, and there's many more that we have put out there to bring education and awareness. If you want to dial up, link in, try to find something on suicide awareness, you can just go to the YouTube channel and find that relatively quickly. It's called CMHA of NB. That's our YouTube channel. So if you're looking for specific information, you can just check out that channel. Also on the channel, you will find we have counselors, professional counselors that are doing different topics on there as well. So it's not just us, the community program coordinators, who were the awareness and education pieces, but we have counselors sharing on there as well. Loneliness, stress through COVID, different things are available at your fingertips on the YouTube channel. So that's one way we've evolved. We've also evolved with a Bounce Back program. So Bounce Back is a professional coach who will have weekly sessions with you over a 6-month period. So this is for anybody who's struggling with anxiety, depression, mild to moderate symptoms. So they can work through their challenges. They have a series of workbooks that they can go through, but also a coach that they can talk with to help them navigate these tools. There's also videos that go along with this as well. So this is a free program that if people are thinking, you know what, I don't need like a full-blown regular sessions with a counselor, but I need some skills. I need some touch-ups here in my mental health. I need some support. Then Bounce Back is a great program that they could take part in, and it's free.
That what you've just said brings up a whole host of thoughts. I think that there are a lot of people who still there is a stigma around mental health, but it is lessening, and therefore there are more people who are interested, especially in their own mental health, because they're becoming more aware of where they are facing challenges. They want to do something about it. But especially for men, I'm going to say, it can be somewhat challenging to work up the courage to go to somebody and admit that you have a problem. This Bounce Back program sounds to me like a nice introduction for people who might like to just sort of see what might be going on. And then they could get, they don't have to actually go someplace, and they can kind of, I don't like to use the word dabble, but kind of put their toe in the water and realize that it's not maybe what they thought it was going to be.
Right, yes, it's a wonderful eye-opener, right? As we dabble, we'll use the word dabble, as you dig in, maybe it's the YouTube channel you start with. It's like, I didn't know what I didn't know until you start digging around and looking, until you start doing some research about why am I not wanting to get out of bed? Why am I not wanting to eat? Why am I angry all the time? Or why am I flat with my emotions? So do some digging, start finding out. And if you look at the YouTube channel, you might be like, all right, well, what's depression about? Maybe these are some things I have going on with depression. And then your light bulbs come on. It's like, oh, I am dealing with depression. This is what's happening to me. So now what do I do, right? So then it's taking those steps. Maybe it's a professional counselor. Maybe it is just a bounce back coach to support you and go through those steps. Or maybe it's going to Addictions and Mental Health locally. Those are free social workers, counselors that you can talk with. And it might not be that you're going to a counselor for 6 months. It might be just a little education, awareness, some touch-ups to see, wow, okay, these are some tools I can use to cope with what I'm experiencing.
Yeah, because I think that certain, it's on a spectrum. How much do we really want to dig in? The programs that you mentioned, the YouTube channel has. I was impressed with the quantity of offerings, and it occurred to me that for someone like me, I would go in there, and as a matter of interest, I could listen to these little nuggets and have you just do one here and one there, and it's not like a huge commitment of time. But when you build up that base of knowledge, that level of awareness, it gives you more tools to not only help yourself through self-reflection, but also your family and your friends. Have you found during this COVID thing that you have fielded more calls and handled more people?
Absolutely. Our numbers went from 84,000 to 205,000 provincially. So yes, COVID has definitely opened the doors for people to be willing to reach out, to find answers, to support loved ones, to find information for themselves, all of those things. That it definitely has changed, for sure, which is good.
Yeah.
Right. I think we were, just under the surface before, but now we're like, okay, this is real stuff, and we all have mental health, so let's get out there, let's take care of ourselves, let's see what we can do to make a difference. It's not going away.
No.
Right? And I don't mean COVID, I mean our mental health. We have it. It's as important as our physical health. We'll go to the doctor, not always, right? But we'll go to the doctor for an ache or a pain. But if we have symptoms of our mental health that are troubling us, we're not sure what to do. Or it's like, well, we don't want anybody to think anything. So we just suffer. But there's help out there.
There is help out there. If you I don't think that it's a new concept that we could use more mental health care workers. So what I'm wondering is the resources that are available for people who are in crisis. We had talked a little bit about the CHCO and so forth, and I'm just wondering, what advice do you have, as far as resources go, for people who are either in a crisis or know someone who is in a crisis?
So I think those severe crisis, we're going to take someone to a hospital, right? We're not going to fool around trying to, take care of that on our own. We're going to probably go to the hospital if it's a severe crisis. If someone is overwhelmed, they're really struggling, not sure how to cope, you can walk into any of the addictions and mental health clinics anytime between 8 and 4, of course, like those are the hours that they're open. But there's always a crisis interventionist available during the day for walk-ins, as well as calling CHCO. I think lots of CHCO is that 1-800 number that we can call for any type of issue. You can call for crisis. You can call if you've been struggling for being alone for a while and you're feeling lonely. You can call CHCO for anything, really. If you are having some challenges, they're there for you to listen. I think we underestimate the power of listening. Listening to someone share all that's happening is huge. There's such healing in that someone can hear me, they can relate to me, they're taking the time to be present with me. And I think that can settle us down a little bit when we're overwhelmed. But of course, we do sometimes need that professional support as well. So it might be listening, and then after you get to the point of being with someone and listening, then what's next? Okay, well, what do you think the next step would be? Not me, listen, this is what we need to do. We've got to do this and this and this, right? It's like, okay, well, what would you like the next step to be? And then move in that direction.
I think, what occurs to me as you're saying that is that with the onset of COVID and the new challenges that we are experiencing, and there are a variety of new challenges, and but I think that we all question our mental health, and we question our need for help. And I think the thing is because you mentioned the word loneliness, and we are in a loneliness epidemic, and we have been in a loneliness epidemic before COVID. It's just become bigger, and I guess the point is a lot of people you don't want to diminish how you're feeling and your emotions and all that. You want to experience them, and if you really would like to be heard or talk to a professional, these resources are in fact available. And I think it's really important for people to know where to go and to not be shy about going,
Absolutely.
So in Charlotte County, where are the walk-in offices?
So the provincial building in St. Stephen, and then on Riverview Avenue in St. George. Those are our addictions and mental health clinic, provincially funded, right? That's where our social workers, counselors, that's where they are located. And that's where I'm in the St. George office on Riverview Avenue. My office is in there as well.
Would you think that because of the increase in the number of calls that you've gotten since COVID, do you think that would indicate that COVID has caused more mental health issues, or how do you see that? Is it just sort of an awareness that's been raised that there's been a lot of under the surface, and then suddenly this has just kind of brought it all up?
Yeah, for me, I think it's both, but that's just my opinion. That's not certainly, I haven't checked into the research on it, but in my opinion, it's both. I think that we have been moving. I heard someone say one day that anxiety has a seat at almost every family table. Well, that's been happening for a while. That was prior to COVID, but I think COVID has blown the doors open on it, so to speak. It's like, wow, it's really prevalent, and it does affect us. COVID has affected us and our mental health. Not saying that we didn't live with anxiety before, but things escalated when COVID hit, kind of thing. So yeah, I think it's both.
Another question that I have, and this is not one that you will have researched either, but I just would like your opinion. With the increase in mental health challenges and the real awareness of the resource challenges that we as a province face as far as access to professionals on a regular basis and the timing and all of that, how do we become more part of the solution? How can we work with the system to make it work for us better?
Right. I think the community organizations or the nonprofit organizations like us, for example, but there's other things out there too. What are the resources in your community? Is there a church? Is there a support group? Is there an art group? What are the things that we can be involved in? We were talking about loneliness, you had mentioned that. And I think about, I'll talk about suicide a little bit. So suicide, there's a myth that suicide rates are the highest around Christmas time. Actually, they're the lowest around Christmas time. And I have my own theory about this. This is certainly not researched either, but there's more happening at Christmas time. We're more connected. Even if we don't have loved ones, let's say we've lost loved ones at Christmas time, there's still activities, there's still things to go do, things to see. People are bringing you meals sometimes. Like, yes, I'm sure there's people that fall through the cracks, but there's definitely more community. There's more connection, there's more happening around Christmas time. And I think, maybe that's something we want to look towards, is how do we become more of a part of our communities? How do we become more connected, that our lives are of value, our lives are of worth? How do we not dismiss our emotions and our challenges and embrace our communities? How do we say, yeah, I am struggling. Oh, I didn't know that you were struggling too with the same kind of thing. We self-stigmatize. So it's like, how do we change that? How do we shift that to move to a community connection? Challenging, of course, in COVID, but we're doing it. We're both vaccinated with our masks on kind of thing, right? We're doing it. So what are the ways we can connect with our communities? How do we connect with other people, be supportive?
I'm thinking too of not just us suffering, but our loved ones who might be suffering or our friends. One of the things that we might do is encourage them to become part of something. I know when people come to me for one reason or another, a lot of times it's, I'm bored.
Yes.
Well, bored is I wasn't ever bored. I mean, I've never been bored in my life, so it's difficult for me to really relate to it. However, connecting with other people is a quick way to reduce boredom. Get involved. Then you won't have time. And I think that there's a lot to helping other people through this crisis. I think that, everybody says, well, we're in this together. Well, of course we're in this together. But we can act in encouraging ways so that we can all cope more easily through this challenge. And I think that one of the problems is that it is a novel virus. So they are still figuring it out, so to speak, and they are doing the best that they can. Now, a lot of people will disagree with that, but I am a firm believer that they are doing the best that they can, and that these convoluted directives, which change constantly, of course they're going to be disturbing and upheaving. But it is nonetheless, it isn't because they're trying to do that. It's just the nature of the virus, and we have to think a little bit more that way, and a little bit more about encouraging the people who are in the front lines and who are calling the shots.
Yeah.
And it's a tough one.
It's been quite a device. It's dividing us, right? And it's how do we come together? How do we all work together to support? To be encouragers, to be motivators kind of thing, rather than the tearing down. How do we build up?
You have a couple of offerings coming up. You have 2 comprehensive workshops, which are not just 1-hour deals, coming up beginning in January. And I believe they're like 6 or 8 week deals. And so one is called From Dependency to Recovery, and the other is on depression. And so what I'm wondering is, who who can participate in these
Right.
workshops, and what will the participants learn?
Right. So D2R, from dependency to recovery, is all about substance use. Right. So anyone who is, and substance use is an illness as well. We kind of look at, oh, someone's addicted. No, it's a substance use illness, just like anxiety is a mental health illness. So people can attend this. It's all online via Zoom. So they can join, register, and learn about substance use, the challenges, learn the background behind it, learn coping tools, skills, that type of stuff. And I'm not sure if that one's 6 or 8 weeks long, and that's a free program.
Is it designed for people who are using or their supporters, or both?
Well, both, really. Definitely for people who are using. But I'm a firm believer in any program that we offer or presentation. If you are a caregiver, the more you learn about someone's illness, the much better you yourself are able to cope and able to support. Mm-hmm. So I try to encourage caregivers as well to attend sessions like this, because we learn, we grow, and we're certainly more compassionate with someone who is facing these challenges. Right.
I think that's, it is interesting. The more there's been a lot written about this. The more that we are aware, the more compassion we can muster.
Absolutely.
And I know there are always times when we just get ourselves worked up to the state where compassion is just simply not possible.
Right.
But as we calm down, and awareness can help that process, we can be more compassionate and more understanding, and we can learn a little bit more about what compassion actually even is. And I think that that's important. Now,
and our own self-care is important, right? If we are a caregiver of someone living with a physical illness, mental illness, then the more we take care of ourselves, the better we're able to support and help someone else. So I think self-care is a huge piece in that as well.
Well, I've written a lot about self-care, especially in the last few months, because I see it as a missing link in families, especially. And I think that given that from time to time people have been laid off work, the children have been homeschooled, so the parents, their schedules have been completely gone cockeyed. And it puts a tremendous amount of stress, what I call unnecessary stress, on people's lives that they're not used to.
Right.
And so by looking at these programs or participating in these workshops, we can become more comfortable and we can actually cope. Our coping mechanisms can be hugely strengthened.
Totally agree. Totally agree.
So what about the one on depression? Because I think that there's a lot of that, and it's another one that's tough for people to admit to, even themselves.
Right. So this one is actually going to be taking place in Graham and Ann. So this is an in-person training or program that will be 6 weeks long. And again, it's free. So it's learning about the illness of depression. It's learning where it might come from. It's learning tools and skills of how to take care of yourself living with depression. Talks about recovery, those types of things. So again, that one is on Graham and Ann, but D2R, from dependency to recovery, is on Zoom, so anyone can attend that. It'd be hard to attend depression on Graham and Ann if someone lives on the mainland. But
right. Now, I guess one question that I have is, does your organization accept donations?
We do accept donations, yes. If you are interested in donating, you can contact me, and then or just send it directly to our provincial office in Fredericton. If you want it to be specific for Charlotte County, then you would just put that tagline on there. This donation is for Charlotte County region, kind of thing. Or you may just want to donate for the province as a whole, which is fine. But yeah, we definitely accept those donations.
And are there any volunteer opportunities?
There are, yes. We have different committees that people volunteer on, so those opportunities are there as well.
So I guess we have just about 2 minutes left, and I'm just wondering if, as far, I like people to be kind of left with something that they can take away and use. So I'm just wondering, in general, taking that 25,000 mile away look, what would you say as a piece of advice based on your experience as a resource person? What would be the best for strengthening communities and strengthening ourselves through these really unpredictable times?
Mm-hmm. Well, I think connection, as I mentioned, that's a big piece. I think learning about mental health and mental illness and how to take care of ourselves, we're much better able to take care of loved ones. So the more we know, the better we get, kind of thing. And I certainly don't mean bombarding, but how do we improve ourselves and how do we learn more about those situations? And I think about how do you learn? Well, then you can contact me, and we go out for free. If you want to lunch and learn, we can go out and do a talk on anxiety for a lunch and learn. I can go into the schools and talk to students. I can go to a seniors group and speak with seniors. Like, we're available for that opportunity to learn more about mental health and mental illness. And we have a list of presentations that we offer. So learning more, I'm certainly able to help you.
Wonderful. Well, I certainly encourage everyone to go to the CMHA-NB website. It's excellent. It has a tremendous amount of offerings. And I would like to thank you, Lisa, very much for coming on the show today. I think that it's really been very revealing to a lot of people, and hopefully it has clarified some thoughts in people's minds that they can take away. So
Wonderful.
Thank you very much, and I look forward to having you back again soon, post-COVID.
Wonderful.
Hopefully
yes.
It'll be soon. At any rate, thank you all for watching the show today, and I look forward to seeing you again on another episode of Fundy Tidings.